Welcome to the Speaking of Women's Health podcast. I'm your host, Dr. Holly Thacker, and I am back in the Sunflower House for a new episode of Speaking of Women's Health. And we are into our second season. We're not quite halfway through. If you didn't catch us last year for season 1, you can go back and listen to some of those topics. This year, we've had a whole wide variety of things to talk about of interest, and today is going to be in honor of May and Osteoporosis Month, everything about calcium, vitamin D, and I'm going to also talk about K2, also known as M7. So we've had a variety of health topics and nutritional topics. Things about current events, like it was very interesting in April when my sister and her family came in from Pennsylvania, because in Northeast Ohio, we were in the totality of the total solar eclipse. And we were sitting there watching this beautiful, rare event unfold with, of course, our eye protection. And we've had several podcasts on eye health. And my husband's like, I can't see anything. And my sister said, well, didn't you listen to your wife's podcast on the solar eclipse, how you're supposed to take them off, the glasses, once you're in the totality so that you can see? And he said, no. Why would I listen to her podcast? I have to listen to her all the time, all day long. I'm like, oh my goodness, that's not very good advertisement. But I am so thankful for you, the audience, who tunes in nearly every week to hear topics on empowering you and your families to be healthy and be strong and be in charge. And part of being strong is having strong bones. And some of the most important building blocks to bone health are calcium and vitamin D. And so this podcast is going to take information that's on our website under the news section. I was interviewed about an article that was published, and it was a study about taking calcium and vitamin D together with the conclusion that it will reduce the risk of dying from cancer, but raise possibly mortality from heart disease. And as you know from our February podcast on all things heart disease is the leading cause of death in women. And so I was interviewed about this study that was published in the Annals of Internal Medicine. And it found that while women who took both calcium and vitamin D supplements decreased their risk of dying from cancer, they increased their chances of death due to cardiovascular disease. And so how do we explain this? And how can we get all the benefits and none of the risk? Well, stay tuned. I will tell you all of this information. And because postmenopausal women have a higher than average risk of developing osteoporosis than premenopausal women or than men in general, and it's because half of women rapidly lose bone when they lose their estrogen. And calcium has been linked to poor nutrition, low calcium, low vitamin D, low estrogen states. And so a lot of women kind of reflexively think if they take calcium and vitamin D that they're going to prevent osteoporosis, which is not exactly true. I mean, calcium is necessary, but it's not sufficient. And having low levels of vitamin D increases so many different health problems and health outcomes. And in season 1, episode 3 was devoted to all things vitamin D. And since I recorded that podcast, we've had even more research come in about the benefits of vitamin D in terms of cancer reduction, COVID lung mortality, even hair growth. And hair, the topic on hair remains our most popular topic. And stay tuned for Father's Day. Right now we're in the month of Mother's Day, but for Father's Day, we will be revisiting hair thinning. So I was asked, why are postmenopausal women encouraged to take calcium and vitamin D? And my answer is that all humans need both calcium and vitamin D. And the historical reason postmenopausal women have been encouraged to ingest both is because of the high rate of osteoporosis in women. And both estrogen and vitamin D help your gut absorb the calcium that your body needs. And as I explained, vitamin D is not a vitamin at all, but it's a pro-steroid hormone. And many adults over age 40 in northern latitudes are vitamin D deficient. So the so-called 400 international units of recommended daily allowance is not based on science, but it's rather mothers know best. And moms used to have their kids drink some cod liver oil every day to prevent rickets, which is soft bones in childhood. And rickets is severe vitamin D deficiency. So you need a minimal amount to prevent rickets, but that might not be the optimal amount for your entire body. So I was asked, what did this research suggest about women taking these supplements together? Is there something bad about doing both? Or is there a better ratio? And my answer, and this is what I tell most of my patients most of the time, is that generally speaking, most adults do not need to take a calcium supplement if you get enough calcium from your diet, as well as having adequate vitamin D. And if you're estrogen replete and not estrogen deficient, you need to ingest even less calcium. And so since a lot of women don't choose, or they're not offered, or somehow they're not counseled about the benefits, risk, and alternatives of estrogen, sometimes they need a higher intake of calcium. And if they're on a restricted diet or a tea and toast diet, or they strictly avoid all dairy, then they may not be getting enough calcium. And we do have an excellent calcium calculator on our website. So if you haven't looked at that, please do. And it's easy to go and find out what foods are calcium rich, like tofu and broccoli and yogurt and low-fat dairy products and salmon and sardines, and so many foods have calcium, sesame seed, almonds. So it doesn't have to just be dairy. But dairy is a very efficient way of getting a lot of calcium and protein. So then I was asked, would this study change any current recommendations for taking calcium and vitamin D together, or is the slight increased risk of heart disease just too slight to warrant any changes? So my answer was that this study in particular used too much calcium, particularly if someone was already getting calcium in their own diet. And that the vitamin D intake they had women take, 400 international units, was pretty low and not even optimal. Had it been higher, I would have expected to see even more reductions in death from cancer as well as cardiovascular disease. And the other point I made is the vitamin D supplements that women were given in this study did not include K2, also known as M7. Now, whenever I mention and ask my patients, are you on K2 with your D3? They say, well, no, I eat broccoli and Brussels sprouts, and or I'm on blood thinners, Coumadin, and I can't take extra vitamin K. But that's not the K I'm talking about. That's K1. K2 is also known as M7. And it does not have anything to do with coagulation. It specifically helps drive the calcium in the bloodstream into the bones, not the coronary arteries. So I think that that is a key. If you take a little bit too much calcium and you don't have enough K2, then you can get calcium deposits in the arteries, which we don't want diseased arteries, because there's so many things that cause diseased arteries. and especially smoking and diabetes and anything that reduces nitric oxide. And we'll have further podcasts on foods that can help promote nitric oxide, that can help lower blood pressure, how to focus your diet on becoming less sweet. November is going to be Diabetes Awareness Month, and so we'll have so much more on that. The next question was, do we have really any absolute evidence that taking calcium and vitamin D over the counter causes any health problems or even any health benefits? And is there just this association slightly with increased cardiovascular risk that's association but not causation? In other words, can we really say anything definitively about this study? And what I replied is that the totality of the evidence in the literature appears to show a slight association with too much calcium intake and arterial disease, as well as we have emerging strong associations of reduced risk of cancer and many other chronic diseases with adequate vitamin D. And D3 also needs the K2 and magnesium. And on our website, Speaking of Women's Health, you can put in K2 and you'll find the list of foods that are rich in K2. And so I have some patients who don't have to take a K2 supplement because maybe they like to eat Japanese natto, Natto, on a regular basis. That's loaded with K2. Very good for the heart. Now, most patients I ask, do you eat natto? First of all, most people don't even know what I'm talking about when I say K2. And then if they do, and I ask them about certain foods, if they're rich in K2, they usually don't know. After Japanese natto, you have things like dark chicken meat. And I would say a lot of times my patients pipe up and say, oh, I like chicken, but just the white chicken meat. Well, it's actually the dark, fattier chicken meat that has the K2. Also, pork and bacon. Some people, for religious reasons, don't eat those foods. Other people don't like the taste of it. So again, it's not necessarily something that's consistently ingested. So then I'll ask about cheese. And if last year you didn't hear my podcast on calcium and cheese, that's a good fun one to listen to. So there's 3 cheeses that particularly do have K2: Swiss, Gouda, and Blue. And usually I'll have someone say, well, I really like Gouda, but I don't have it that often. Or, oh, I love blue cheese, but it's a treat. So again, it may not be very consistent. Now, eggs are a very healthy food. Unfortunately, they've been demonized unfairly. The egg yolk is kind of the prime part of the egg, rich in choline and vitamins and K2. And if you have eggs from chickens that have been fed omega-3, you get omega-3. And most Americans don't ingest enough omega-3s. Now, you don't necessarily just want to try to go pop a fish oil capsule. In fact, last season I had a great podcast on, should you eat fish or just take fish oil capsules? And basically the short answer is you should eat foods rich in omega-3 and really focus on those anti-inflammatory foods. The egg white is very rich in protein, and eggs are very low calorie. And I think because of the cholesterol content, they have been demonized too much. And the relationship with cholesterol and heart disease is very interesting. People can have high cholesterol levels and not have heart disease. Conversely, you can have relatively normal cholesterol levels and have heart disease. So it's a complex equation. A lot has to do with the metabolic parameters, insulin resistance. And I particularly like to see my patients have triglyceride levels under 100. And if they're under 50, it's like, wow, that's terrific. But certainly under 100. And when triglyceride levels get to be over 400, that's really pretty dangerous. And we don't usually use oral estrogen if the triglycerides are very high. And we really assess for insulin resistance. And we have a lot of information on our website about how to be less sweet. So you have been listening to the Speaking of Women's Health podcast. I am your host, Dr. Holly Thacker, the Executive Director of Speaking of Women's Health. And if you've not been on our website, please go on speakingofwomenshealth.com. You can follow us on any of the social media channels. If you're listening to this podcast and you want to see the guests that I interview, you can go on our YouTube channel or our Rumble channel as well to see and hear our podcast. So getting back to the questions I always ask about this study that was recently published in Annals of Internal Medicine. It was, what is the takeaway for our readers who are postmenopausal, who might be anxious about their supplement routines? Well, what I said was that women should be concerned about the risk of hormone deficiency, because that affects calcium metabolism and bone metabolism and cardiovascular metabolism and neurologic and skin and genitourinary. And that all people should be cognizant that excessive calcium supplementation is not a treatment and it's not a substitute for preventing postmenopausal bone loss. All adults and children should avoid vitamin D deficiency. And those pushing the intake of calcium in their diet and or via supplement, along with vitamin D, need to get a diet rich in K2. Go ahead, you can start to cook and experiment with natto if you would like. Or what I do most days, not every day, but because I do like some foods that have K2, and I do like to try to focus on whole foods and ingesting macro and micronutrients from my diet. But I do buy K2 with my D3. And I think that's a very important supplement that does support your bones, your teeth, the periodontia, as well as your immune system and cardiovascular and joint health. So I really appreciate you joining me on this podcast. If you've enjoyed it, please share this with your friends and family. And you can follow us or subscribe for free anywhere you listen to podcasts. Apple iTunes, Spotify, Amazon Music. You can also listen to our podcast on our Speaking of Women's Health website. And if you're on our website, you can go to the Contact Us portion and ask us a question. And we just may answer your question on our next podcast or even devote a topic to what you're interested in. So remember, be strong, be healthy, and be in charge. And I will see you next time in the Sunflower House.